Hey there, it's me, Dr. Daniel, and this is a supplemental video to the other video interpretations that you've received as part of your file related to autoimmunity specifically. So there are quite honestly so many factors and so many things to consider with respect to healing your body from autoimmune conditions. And so I feel that it's necessary to begin the process of educating yourself, knowing as much as you can of how this is going to work. And so this is kind of the first step towards that. Whether or not you already know this information, I just want to make sure that I do my job as far as delivering as much as I can for you. Now, when we talk about autoimmunity, there are different stages of autoimmunity that an individual can find themselves in. Stage 1, silent autoimmunity, is when you have elevated antibodies. These antibodies would be markers, biomarkers that we do from different types of tests that tell us that the immune system is attacking tissues of your own body. That's basically what the antibody markers are. Now, you could have elevated antibodies with absolutely no symptoms or signs of tissue destruction, meaning your immune system's attacking the body. It shows up and we see it, but there's no symptoms. So just know that that's possible, and that's stage 1 silent autoimmunity. This is also why it can take years, on average 14 years, for somebody to get an accurate and proper diagnosis. Now, when we talk about antibodies, let's use the thyroid, for example. There are times where somebody will develop antibodies to the thyroid, which means that the body is, the immune system is mounting an attack against the thyroid. Fine. You can then say, okay, this person has a autoimmune condition for the thyroid. Now, that's not where we should stop. The reality is that if the immune system is attacking the thyroid, there's a good chance that your immune system is attacking other parts of the body as well. So the part of discovery should continue to see if you can identify other areas that are being attacked. We'll talk more about that in a bit. Stage 2, what happens is people, if they have no symptoms in stage 1, usually because we have no symptoms, we're not going to do anything about it. So we can progress to stage 2, where in stage 2, you're going to see elevated antibodies, but the individual now has symptoms, yet there's no loss of tissue or there's not extensive tissue damage. So again, going back to the thyroid, if the immune system consistently attacks the thyroid, there's a chance that eventually you damage the thyroid, and now that's going to be a lifelong case of having to use hormone replacement because thyroid hormone is very important. Now, hopefully, for that individual, they catch it early enough to where their thyroid's still functioning and you can manage that successfully moving forward. But just note that, again, stage 2 would be where you have elevated antibodies, you have symptoms, and then there's no noticeable loss of tissue damage. Stage 3 would be where there's elevated antibodies, there's symptoms, and then, of course, you have ultimate tissue destruction. So, again, that would be that thyroid patient where their thyroid gland is completely destroyed, and now that is a completely different case, right, with respect to moving forward. Now let's switch to a different slide. This slide here is what I use to help patients and other doctors that I'm actually teaching on autoimmunity, what the process is going to look like. Like I said, step number 1, where is the rest of the autoimmunity? So there are biomarkers. Once you identify there's an autoimmune process, then there's other biomarkers, follow-up blood tests that you can do to see are there other areas that are being attacked? Your joints, parts of the brain, parts of the thyroid, the pancreas, the stomach, the intestinal tissue. And then again, what stages, if any, are each of these, if they show positive, are you in? Ultimately, one of the worst conditions that we can be looking at is when the immune system attacks our DNA. So that would be nucleic acid autoimmunity, and that is a very strong case for lupus, right? So when people have mortality with lupus, it's because they have severe damage to their DNA. They can't replicate, and so therefore they cannot create new tissue, and that's a pretty sad process there. As we move down, so again, you identify what other parts of the body are being attacked, if any. Now, sometimes you don't don't have to go and do all that. Maybe you start to incorporate treatments like we are, and you start to see improvements. So regardless of where the body's attacking, you can blindly move forward. And if there's improvement based on dietary modification, lifestyle modification, and all the other things we're going to be working on, awesome. Then maybe you don't have to move into that. But I always like to just kind of check in. And I did add a couple of markers. And of course, as we move forward, we'll be retesting and I'll be looking out for other areas. Now, the most important factor when it comes to addressing autoimmunity are going to be the dietary triggers. So there are four columns, triggers for major categories of triggers. You have dietary triggers, lifestyle triggers, chemical triggers, and then infectious triggers. With dietary triggers being the most significant. And when I say triggers, these are basically things that are causing your immune system to attack your body. What dietary triggers are you exposing yourself to? Are you eating knowingly or unknowingly that are causing your immune system to wig out? That is the ultimate question. These are some of the most common things. So you're going to see gluten, especially for somebody who has celiac disease, grains, dairy, nightshades, lectins, salt, and then not stabilizing blood sugar. So these are the dietary factors we need to begin with and really try to focus on over the next few months. Also, what lifestyle triggers? Are you getting enough sleep? Do you have healthy relationships or support groups? Are you over exercising or under exercising? What's your work situation like? Is your work a form of positive stress or negative stress? Are there chemical triggers that you as an individual are exposing yourself to knowingly or unknowingly? These could be a number of pollutants that are in an environment that you have no control over. But there's also chemicals that we expose ourselves to that we do have control over. Common, daily products like shampoos and deodorants, fabric softeners, things like that. You and I could be exposed to fabric softener. I don't have autoimmunity, so it does nothing to my body. And we can agree that chemicals are not good for anyone. But in your case, with your immune system, it could be toxic, highly toxic, more toxic for you than for me. So, this is where it helps to identify specific chemicals in your situation. Are there any other triggers, right? Molecular triggers that can be part of dietary, lifestyle, chemical, or infections? This is where you really begin to study your immune system. You pay attention to your white blood cells over time, something called T and B cell lymphocytes over time. And this is really based on blood chemistry. We're not there yet. Also, your immune barriers. Are there any other signs of immune barrier dysfunction? What do I mean by that? Well, we can talk about immune barriers. Let's talk about like your skin, right? The skin is what protects the outside world from the inside of our body. That is an immune barrier. When you have immune barrier dysfunction to your skin, when you have leaky skin, you can have rashes, psoriasis, eczema. You have all these symptoms like that. Your digestive tract is also an immune barrier. When you have leaky gut, you can have digestive issues, diarrhea, constipation, bloating, stomach pain. You have a pulmonary barrier. So obviously you're breathing, and when you breathe in and out, your lungs, the tissue has to protect what you're breathing in, the outside world, from the inside. So what is, you could have leaky lungs just like leaky gut, and leaky lungs would be like respiratory conditions, asthma, things like that. There's a nose and throat barrier. So when you have leaky nose, this is like chronic sinus issues, runny nose, that type of stuff. And then there's also a blood-brain barrier. And so when people have blood-brain barrier issues, leaky brain, that could result in depression. It could result in anxiety or panic, ADD, attention deficit issues, things like that. So are there any other immune barriers that are being impacted? So I'm just trying to give you a high-level overview of all the things that we would want to think about with respect to addressing autoimmunity. But like I said, where would we begin? Well, from the initial blood chemistry panel, we see where, kind of, if I'm talking to you about this, it's obviously because we've identified some level of autoimmunity. We may not have the complete picture, but this begins the process of narrowing all that down and moving forward. Obviously, we can't test every single marker under the sun because of cost and because of the amount of blood it would take. So, some of this we have to manage and look at it over time. But what's the biggest thing, the biggest win that we can get? Usually the biggest win for an autoimmune patient is going to be optimizing their dietary intake and dietary triggers. So let's talk about that for a little bit. What are the main dietary considerations? First of all, there is restrictions. There are things that we want to restrict from our diet that we know that is helpful for autoimmune patients. And the main ones are going to be gluten, dairy, foods that are cross-reactive with gluten or other grains. What I mean by that is that you can have a food, let's say gluten has a specific protein structure. You can have another food that is not gluten specifically, but the protein looks similar to that. So if your immune system has decided it doesn't like gluten, it doesn't like that shape, then it may also not like that other food that is not exactly gluten but looks like it. So those are cross-reactive foods, nightshades, and then lectins. And we can talk about all that as we move forward. Other dietary considerations would include to try to make sure you're not doing too much sodium, although I would say that adding some sea salt every day is a good starting point, but we don't want to overdo it. You also want to make sure you keep your blood sugars stabilized. I would first recommend a gluten-free diet / paleo diet. And this is actually what I'm suggesting that we would start with. You would proceed for about 4 to 6 weeks and track changes. Pay attention to your body. Are you feeling better? Is swelling going down? Is inflammation going down? Any of your symptoms? Are you thinking better? Digestion, bowel movements, is all that better? If we're not better 6 weeks in, then we may consider transitioning to an autoimmune paleo diet. And then again, we would proceed for another 4 to 6 weeks. Each one of these, it's more restrictive. Now, we want to be careful with being too restrictive for a long period of time. And why that's important is because when you restrict foods, you actually run the risk of creating microbiome dysfunctions within your digestive system that is not good. That also creates other problems. In my opinion, the most diverse diet is the best diet. So, on one end, we want to be diversifying our diet and eating all the foods. But then when we're talking about autoimmunity, we have to be specific. We have to identify what foods are causing problems. So this is where we begin the process. Dietary considerations, I'm going to again say that we should start with paleo. That basically means let's avoid gluten, let's avoid dairy. And when I say dairy, basically, all your milks, eggs would be completely fine. I'd be okay with you consuming eggs for right now. But if we transition to autoimmune, we're going to eliminate eggs. Obviously, we want to avoid processed foods, fast foods, or fried foods. What's permitted? What can you eat? You can eat all the vegetables, mild or moderate amounts of fruits. Fermented foods, kimchi, sauerkraut, fermented vegetables, rice and gluten-free grains would be okay in small amounts if you must have them. If you're okay going for 6 weeks without it, I would say let's do that. Let's focus on increasing your fats, olive oil, avocado oil, flaxseed oil, all the meats. You can eat all the meats, nothing wrong there. Now, let's just say, again, this is the diet that I want you to follow. I have attached handouts for you to review, but if we don't see improvements, then we're going to transition to a autoimmune paleo diet. The differences here would be that not only are we going gluten-free, dairy-free, but we're going to eliminate all grains. No rice, no oats, tapioca, quinoa, millet, teff, no grains whatsoever. No dairy, no whey. We really want to avoid any GMO proteins such as corn and soy, and you have to read labels because there's a lot of soybean oils in condiments and things like that. Also, you would avoid lectins and nightshades. This would include things like seeds, nuts, legumes, tomatoes, potatoes, eggplant, and peppers. For autoimmune patients, I'll just tell you that there's a lot of autoimmune patients that these are causing inflammation for them. Not everyone, okay? And so I don't know that without specific food sensitivity testing. We can do that. The tests range from $200 to $400 though, so they're quite expensive. But I would say starting off with just following paleo or AIP would be a good choice. So what is permitted on an AIP diet? 6 weeks down the line, if we don't see improvement, you can eat vegetables and fruits, fermented foods, healthy oils, and meats. So basically meats, vegetables, fruits, and that's pretty much it. And then your oils. So again, this is the big stuff, that I wanted to talk about with respect to, it's just an additional video to supplement the autoimmune findings. Of course, we can talk about this at a consult, or if you have any questions, you just send them my way and I will be happy to answer them.